Hi, my name is Jessamine Phillips, and you've tuned into my Culminating Experience project. Today, we will be discussing my experience with the course Introduction to the Clinical Nurse Leader Role. I will also review the key issues that I have identified and prioritized in the Clinical Nurse Leader Connect posts. For one key issue, I will apply the SMART Goals template. Finally, I will finish up with a summary of the culmination project. My overall experience with this course I feel was very positive. Through this course, I have had the opportunity to examine and reflect on my nursing career. It has helped me critique and analyze each of the microsystems that I have been privileged to work with. Additionally, I think that I have an accurate understanding of the clinical nurse leader role, his or her responsibilities, and the difference between a clinical nurse leader and a clinical nurse specialist. Furthermore, I enjoyed the coursework because I was able to relate my education and graduate school work to my work experience. I also feel like it has broadened my understanding of the nursing profession. I found the posts of the other students to be enlightening because of the vast range of backgrounds that each one of us have. Finally, I enjoyed the feedback I received from Dr. Howard. He was actively engaged and participated in all of our discussions. I also found Dr. Trevathan's Food for Thought discussion post to be very inspirational. I have reviewed all of my Clinical Nurse Leader Connect posts throughout this course. Many themes and key issues have emerged. Having experienced 5 different microsystems, I feel like I have gained some proper authority on analyzing and interpreting different systems. Some of the highlights from my posts include staff retention, nursing satisfaction, quality and safety of nursing care, looking for the good, excellence, and the clinical nurse leader role as a continual process. I also found these themes to be fluid throughout my colleagues' posts as well. Nursing retention, nursing satisfaction. In examining nursing retention and nursing satisfaction, I related to this through my own experience of job dissatisfaction. To elaborate, staff retention is key for a high-performing microsystem. Units with high turnover rates facilitate disorder, jeopardize continuity of care, and make quality improvement challenging. Nursing retention and satisfaction with the job environment go hand in hand. Drawing from my Clinical Nurse Leader Connect post, I discussed how at Barnes-Jewish Hospital I was stimulated to improve my nursing skills and job satisfaction through my certification journey. By becoming a PCCN, I gained respect from my colleagues. Additionally, the process served as my own quality improvement project. I felt more in command of my nursing skills while also utilizing the title as a tool to perform my job well. This theme captures Essential 2 of Organizational and Systems Leadership, Essential 3 of Quality Improvement and Safety, and finally, Essential 4 of Translating and Integrating Scholarship into Practice. Furthermore, the clinical nurse leader role of nursing leadership, clinical outcomes management, and advanced clinical assessment are integrated here. Quality and safety of nursing care. Another key issue for the clinical nurse leader role is that of quality and safety of nursing care. In my post, I discussed about a critical medication error that I discovered during the first year of my career. I found a patient that had arrived from the emergency department to my unit with an active heparin infusion being administered while he had a documented history of heparin-induced thrombocytopenia. The patient did not have an order for the heparin, so this calls into question many issues within the system of medication administration, technology use, and finally, patient safety. The Sentinel event is a classic example of what was demonstrated in the Institute of Medicine's report to Err is Human. Furthermore, the American Nurses Association has been researching for the past 10 years the association between the quality of care a patient receives and the term patient outcome. This theme captures clinical outcomes management, care environment management, quality improvement, leading the redesign of client care following root cause analysis of Sentinel events, and finally, gathering, analyzing, and synthesizing data related to risk reduction and patient safety. Essentials identified include Essential 2, Organization and Systems Leadership, Essential 3, Quality Improvement and Safety, Essential 5, Informatics and Healthcare Technologies, and Essential 7, Interprofessional Collaboration for Improving Patient and Population Health Outcomes. Looking for the good. Sometimes I think as humans and in the healthcare system, we have a tendency to focus on the bad. Through this course, my nursing experience, as well as having the experience of working in several different microsystems, I've been able to examine the healthcare system and the nursing profession under a different microscope. For instance, the idea of positive deviance is critical to the clinical nurse leader. Clinical nurse leaders are catalysts for change and facilitate it through collaboration and communication. In my post, I discussed my former manager, Diane, as an example of a positive deviant in the workplace. Her method of identifying the problems within the unit demonstrated that the answers to key issues are within the environment themselves. Additionally, her integration of staffing feedback and implementation of the Rising Star campaign promoted nursing retention, nursing satisfaction, and patient satisfaction. Furthermore, I was able to utilize this module within my own day-to-day unit. I began more actively complimenting my coworkers on a job well done. My manager recently commended me for my ability to focus on the positives as a springboard for problem solving and change. Extrapolating from the clinical nurse leader certification, many items pertain such as nursing leadership, utilizing peer feedback for evaluation of self and others, interdisciplinary communication and collaboration skills, promoting positive work environment and a culture of retention, and applying systems thinking to address problems and develop solutions. End of program competencies include essential to organizational and systems leadership, participates in a shared leadership team to make recommendations for improvements at the micro or macro level, and essential 7 interprofessional collaboration for improving patient and population health outcomes. Excellence. As mentioned before, I've had the opportunity to work in 5 different microsystems. 2 of those 5 are magnet designated facilities. I can say through my work experience, there are key differences between magnet facilities and non-magnet facilities. While working at Barnes Jewish and Stanford Hospital and Clinics, I've been encouraged to further my education and find resources to do my job well. At magnet facilities, excellence is a culture. At these magnet facilities, proactive they are proactive about key issues, and this enables them to improve quality care and satisfaction. I also discussed that at Stanford, it currently holds a safety rating of a B from the Leapfrog group. While it is not an A rating, they have developed an action plan to facilitate improvement of that safety rating. A huge quality nurse indicator and safety component of hospital care is the hospital-acquired pressure ulcer rate. Right now at Stanford, they have implemented a code HAPU, where if a pressure ulcer is discovered, an overhead page is called, and within minutes, the nursing supervisor, a wound care nurse, and a dietitian are at the bedside to evaluate the patient. Pulling from the clinical nurse leader certification blueprint, clinical outcomes management is highlighted. Here, the clinical nurse leader is in charge of an illness and disease management, identifying client outcomes that require intervention with special focus on problems amenable to nursing intervention. Additionally, the clinical nurse leader demonstrates accountability for processes for improvement of client outcomes. End-of-program competencies identified include Essential 3, Quality Improvement and Safety, utilizing a variety of data sets such as HCAHPS, Nurse Sensitive Indicators, and NDNQI, and Essential 5, Informatics and Healthcare Technologies. For my SMART goal, I've chosen to focus on a key issue that I've experienced in all 5 microsystems I've worked in, alarm fatigue. After a while, the dinging noises just become a nuisance and we learn or train ourselves to tune it out. A sensory overload situation, so to speak. The majority of my career I've spent working in step-down and intermediate intensive care units. So all of my patients have been on telemetry monitors and many of them have been on continuous pulse oximeters. I completed some continuing education hours for my license recertification, and I did a learning module about alarm fatigue created by the AACN. I learned that up to 100% of alarms can be false or don't require an action. Given this, staff frustration, missed alarms, delayed alarm response, and patient safety events follow. According to the AACN, since 2005, more than 200 deaths can be contributed to alarm fatigue. Multiple key issues come into play here: staff nursing satisfaction, safety, and patient satisfaction. You wouldn't believe the number of complaints we receive in patient surveys about the noise level at night when the patient is trying to sleep. For my SMART goal, the Intermediate Intensive Care Unit at Stanford Hospital and Clinics will serve as the setting for alarm fatigue management. The Intermediate Intensive Care Unit has identified a goal of reducing alarm fatigue by implementing evidence-based practice on prevention of false clinical alarms. The best way to prevent alarm fatigue is through proactive alarm management. A clinical nurse leader, with the assistance of the clinical nurse educator, will establish interprofessional teams to address issues related to alarms and develop policies and procedures related to their findings. Beginning November 1st, 2014, a weekly education seminar will take place during the designated huddle time prior to the start of the shift. For 6 weeks, a new topic will be reviewed with the nursing staff, nursing assistants, and non-licensed personnel. Evidence-based practice that will be covered will include proper skin preparation for the ECG electrodes, changing the ECG electrodes daily, changing batteries promptly, troubleshooting alarms rather than ignoring them or turning them off, customizing alarm parameters, and finally, monitoring only the patients with clinical indications for monitoring. After 6 weeks, charts will be audited for compliance with the evidence-based practice education material provided to the units. Furthermore, an employee satisfaction survey will be administered to see the perception of this implementation process. 5 volunteers will form a small segment of the shared governance model known as Alarm Management Leaders, or AMLs. The AMLs will serve as liaisons throughout the hospital, and provided the key issue project shows improved outcomes, this SMART goal and project can be implemented at the macro system level. In summary, key issues identified throughout this course are patient safety, nursing and staff satisfaction, quality improvement, excellence, and looking for the good. The clinical nurse leader role is a continual process. My experience with travel nursing and all the microsystems that I have worked in has led me to the understanding that there is no perfect system. All microsystems have issues, and it is the degree to which leaders take initiative to improve those issues that distinguishes the systems. Change takes time and effort. The clinical nurse leader is a generalist that collaborates and coordinates with multiple disciplines to promote positive patient outcomes. Here is a list of my references. I hope you've enjoyed my presentation.